would be the appropriate role of government authorities to solve problems of people with dementia?
Unfortunately, there are not much dementia policies or schemes that support dementia. So that is something that a lot of people are working on in the Indian context. For a start, like dementia policy, so a lot of countries have it. Something like UK has, Australia, for Australia and Japan, dementia is like priority number one as government policy. The hospitals are there. They may be like more aware of dementia. They are able to provide better care for dementia. So a lot of dementia care comes under rehab. So that has to be redefined how it works. So yes, there is so much. Very difficult to answer anything in this particular time span.
So, how can the tech of generative AI help with solutions for dementia?
AI itself can help in two ways. One is in diagnosing, especially diagnosing those patients who are suitable or eligible for this newer medications like newer anti-amyloid therapy which are available now. They have a very, we can say, a lot stringent or a strict criteria for including those patients. So AI can help us in identifying those patients who can be eligible for the management for those therapy is one aspect. Other aspect is in rehabilitation. Like AI can be the bridge between what my brain wants and what I want to do, or like how I can do. It's just like there's something called brain-computer interface, which is very common and is in very nascent stage when they are trying to use those instruments or those AI external devices to help us to do day-to-day activity. Simple example is a person who wants to go to reach to his house, but he is confused. He cannot go out. He's confused and he is lost in his own environment. There AI can help him by navigating to his house. One more example is simplest one. One of the most simplest is some people want to they some of the patient with dementia they have wandering out. They will go out. They will move around. They will be lost. So AI, just simple GPS, some wearable devices which can help them to map him out, and we can follow them where they are going. The simple wearable Apple devices or any watch or any phone or small GPS devices. This is the simplest which is available now. Definitely AI will help. AI will have a role in dementias, especially setting up dementia friendly homes, like mentioned before. Dementia friendly homes where they can use the instruments, where this AI can help them in reminiscence therapy, in reality orientation. Simple one, you can put an alarm clock or Amazon Prime devices which can tell them today is 9th of September, today is or whatever day today is Monday, today is Saturday. Now is 9 o'clock in the morning, 12 o'clock in the evening, 9 o'clock in the morning. You have to take this medication which is there in the blue box. This way they can help.
I've also read about these reports or a study conducted by MIT that repeated AI use actually affects the cognitive health of healthy individuals. Like your attention span reduces, your focus or your habit of doing any work or computation work and everything reduces. But directly affects the cognitive health. Isn't it in contradiction to like say trying
Uh,
to improve the health of somebody who's already got it deteriorated?
I will say, say it is very different context, but yes, repeatedly, if you are engaged in AI, like if you are engaged in your mobile phones or TV, and so you are not going for the social contacts, like you are becoming withdrawn. That itself is a risk factor for dementia, right? So see, everything you have to use in limits, even
It can be
medication
used as a tool, rather.
too.
It
Yes,
can be
yes,
used as a tool.
yeah.
What would be the appropriate role of government authorities to solve problems of people with dementia?
Yes, I think that would be a very big discussion. But then, yeah, I think nice for a start that we have a dementia policy in place. So, unfortunately, there are not much dementia policies or schemes that support dementia. So, that is something that a lot of people are working on in the Indian context, where we reach out to the government and for a start, like dementia policy. So a lot of countries have it. Something like UK has, Australia, for Australia and Japan, dementia is like priority number one as government policy. So something that we're trying to get it in India, that will definitely help. So once the policy is probably in place, with that people will have a lot of help. Maybe caregivers can have help. So however that is defined, that is also a different thing. But yes, when we talk about government of India, I think that is the first thing that came to my mind. But there could be other things like where the hospitals are there. They may be like more aware of dementia. They are able to provide better care for dementia. So a lot of dementia care comes under rehab. So that has to be redefined how it works. So yes, there is so much. Very difficult to answer anything, in this particular time span.
Thank you, ma'am. Thank you, sir. I'm prompting a guest to kindly unmute themselves.
Thank you.
Thank you, sir.
Dr. Grewal from Delhi. Thank you very much for this effort and on mental health in the elders. We have a hospital in Delhi called the Pacific One Hospital, and I have started an elder care program in that, and that is the first hospital in Delhi to do it. We are planning to have a special package on mental health of the elders. My question to both my experts, first of all, congratulations, beautiful presentations, is we are facing a number of barriers to get the elders to come for a mental health checkup. We all know what to do after we have diagnosed, but I feel that the barrier of getting an elder to get a mental health assessment done is our first challenge. Could you please highlight some ways to overcome this barrier, which is posing a big challenge to us? Thank you for the opportunity.
Okay, so to answer Sir's question, I want to emphasize public education. The only way forward is public education, making the public aware that there is something called cognitive impairment and there is no stigma associated with it. We should go to the public, go to the community, do patient education programs, all those things. Otherwise, this stigma, like we cannot cross that barrier. I'm as a clinician, I'm seeing a lot of patients coming here. One patient, I'm not disclosing those names. People who are highly educated also, they don't come and completely become open regarding the dementia. They don't say like my ward is have memory loss and this thing. They will tell, okay, he has some memory loss. Okay, you just evaluate it and give them medications and let me go. They don't discuss, they don't disclose. Maybe the stigma or maybe they have some other thing. We don't know. But we have to move to the community. We have to tell them. In my family, few people have some cognitive impairment, which I didn't know, I was not aware of. Now thinking retrospectively, okay, that could be the cause.
So I'll just add a few things over here, like, with the dementia NGOs, the experiences that I have had, exactly like what Dr. Sandeep has mentioned, that public awareness is definitely the key. First thing, like in the community that you're targeting serves, in Delhi, where you mentioned that you're starting with it. So maybe you can start small and just target the community. And then maybe, that public awareness, screenings. So a cognitive assessment is a very detailed thing that happens in a memory clinic, but there are a lot of tools that are available that can be used as public screening for dementia or cognitive impairment. And that is something a layman can do it. So when you doing such programs like what is dementia, making people understand that it is a disease and not like part of normal aging, the more we emphasize on those things, maybe that stigma and that social pressure will come down. And it has happened over the years. Like, I can say that over the last 10 years, there have been so much change in that approach towards dementia or mental health also. So if you see, there are suddenly so many movies who have, come up for dementia, and that will help a lot for the public awareness also. But if you're targeting like a very specific place, then these screenings, as we have done a lot in the peri-urban areas of Hyderabad and a lot of cities, just doing things for maybe poor people, or sometimes we do it for gated communities. just the basic screening, and in case when we identify that there is a person that can be referred to a doctor, that is done. So that effort has to be there for the public awareness, something very similar to what we are doing right now with help of Vishwa Talks, right? That this kind of webinars, or like having the experts talk about the dementia, like what is dementia and what is normal aging. That effort will definitely help to change the way people are perceiving. So there's generally denial also, there is social stigma, there is, and it will take time, but there are so many, examples, like there are other associations who are working for dementia. Best approach, starting with public awareness, screenings, and then that education of dementia coming from the doctors, from the medical team. So that makes a lot of difference.
I'd like to add something. I think something like this, the awareness of this kind should be also be incorporated with our schooling systems or education systems at a very early age. Like, I think we are barely taught about how to take care of our elderly while we are growing up in schools. We are taught from a very, say, geographical location aspect, like, yeah, culturally you're supposed to respect elders, this, that. It can be taught in a more educative, fact-wise manner, and what complications can come in when your folks are getting older, and put them in points, dementia, Alzheimer's, each and everything. And they can be given a hint at a very young age, so that while they're growing up, they're more curious about it. If suppose they come across it anywhere, they'll have the awareness of it, basic awareness, and they'll be able to get in touch with the correct authorities. Requesting another guest to kindly unmute yourself.
Sir, thanks for the session. It was very informative. What I would like to ask you was, my mom is 75 years old. We had doubts where it is dementia or normal aging. A lot of those myths were actually cleared because of your presentation. And we had actually taken her to a doctor also. He did some basic tests and he said it is normal aging. What I want to know is that as her age advances, is there any further test that we can do, say something like an MRI or something else, wherein we would be like, very sure that it's not dementia or Alzheimer's? The reason I'm asking this question is because her mother also had Alzheimer's. So if you could give some clarity regarding, like, are there some other kind of tests that we can do just to be sure?
What we can do, ma'am, here is detailed cognitive assessment to see how she is performing on those tests. First of all, if my mother or my father has Alzheimer's, have cognitive impairment, it doesn't mean like I will also have. It is always a risk, but doesn't mean like always I will end up with dementia. Number two is some forgetfulness. You can go for this detailed cognitive assessment where we can test all the domains and we can say like, oh, there is some impairment here and some impairment there. What we can do is whether there is an impairment or not, like whether she is in a mild stage or in a severe stage. Number two, what we can do is the further tests which are available for diagnosis of dementia are, we have CT scans, we have MRI, we have PET scan. But all those things should be done if I have high suspicious of having dementia or high suspicious of having a cognitive impairment. So I will advise you to first to meet a neurologist or a cognitive specialist to do a detailed cognitive assessment. Then we should map out what domains have been affected or what is her score. Then you can go for MRI and PET scan. Now, one more thing I want to add here. If in the MRI brain there is some atrophy, the MRI brain will help in diagnosis, but it never helps to predict the severity of the disease. A patient may have very normal MRI who will be performing bad in cognitive assessment, but patient reverse is also true. Patient having very bad MRI showing a lot of atrophy, but clinically he will be in the mild stage or in SCI or MCI stage. So not to worry about now. Ask her, keep her active in day-to-day activity, and if you feel there is some worsening, go to a neurologist. You can go for MRI or you can go for PET scan. But I will suggest you to go to a neurologist or a cognitive specialist who can do a detailed cognitive assessment and you can tell you.
Yes, sir. We had taken her to a neurologist and the cognitive assessment has been done. and he has actually cleared her and told her that it's just a part of memory loss. I mean, slight memory issues as part of normal aging. So I just wanted to be sure that, in future, if something happens. So you are saying that the best thing is to just again take her to a neurologist if there is any further deterioration in her condition,
Deterioration,
right?
and also you can go for this MRI image.
Okay. Thank you,
So
sir.
in
Thank you.
MRI imaging, it will say if there is an atrophy, then okay, it will say whether the patient may progress to the stage of dementia or not. Okay, but
Okay.
those prediction are also not. We cannot. They are not clinically so correlate with progression, but we can get we can expect something. Okay, but go for MRI.
Okay. Thank you, doctor. Thank you.
Thank you, Dr. Jain.